Hello, everyone. I'm Maria Baños Jordan, the president and founder of the Texas Familias Council. Welcome to this conversation, the special conversation we're having today with Dr. Alexis Cruz. She is a doctor in residence at Lone Star Family Health Center with its main location in Conroe, but she also reaches out to our outlying areas. Welcome, Dr. Cruz. Thank you for joining us today.
Thank you for having me back.
Yes, we had a wonderful conversation not too long, a couple months ago, where you did a wonderful job of kind of letting people know what to look for as far as working through the pandemic, things that were coming up on the horizon, and just different public health issues that are affecting our community. So I appreciated all the information you shared with us, and I wanted to have you back because we are entering a new season, our fall season. And this week specifically, we are celebrating in our Latino culture the traditions, the ancient traditions of Dia de los Muertos, which honors life and memory of our loved ones. And I think it's a beautiful tradition. But it also reminded me of just all the loss and grief that so many of us have gone through over the last few years with the COVID-19 pandemic. And as you and I were talking about previously, not just the loss of loved ones, but also the loss of our routines or some of our social events or things that we were normally accustomed to having that we've had to adjust, and how that's impacted both our physical and mental health. And so I wanted to just kind of ask you to maybe share some of the experiences that you've been having here recently in our community, the health concerns, and also how you feel people are adapting and moving forward through these periods of adjustment.
Yeah, I like how you put it in that grief, I think for the past 2 years has taken on so many different forms. Whether you are grieving the loss of a loved one, right, like you said, or for us as physicians and people in healthcare, grieving the loss of someone who may have been a stranger or a patient that had an impact on you. And like you said, grieving the loss of the life you led before the 2020 pandemic, before the world shifted and changed. Um, Grief can take so many different forms. And I am seeing that I think the majority of people are processing that grief very well and moving forward. But I do think that a lot of people are having trouble with it, having trouble going back into the way that trying to transition back into normality, right? What does that look like now? Um, you and I were kind of talking about it earlier, but this desire to go back to how things were while also weighing kind of the risks and benefits of what we now know is important to our health. Like I mentioned earlier to you, we were kind of talking about now being kind of self-conscious or health conscious rather about how many events you're attending in a week and how many people are at those events. And I think that the pandemic really forced us to look in the mirror and take a look at our health and force us to now on a hopefully daily basis take into account your health, which might mean that life looks a little different. Life may, unfortunately, for some people, look a little lonelier if you're not out with your community. I would encourage people as we enter, Dia de los Muertos and the holiday season to find ways in which you can still get with your community in a healthy way. And I remind people that a simple mask can do so much. A vaccine can do so much to help you feel protected while you still go out and enjoy your life. And I would implore people that if you've dealt with anxiety or depression before, that you be proactive about that now, because we do every year see seasonal affective disorder or seasonal depression. It's very much a thing, and we are getting to the point where daylight savings time is going to occur, and it can be hard if you're going into work when it's dark and you're leaving work when it's dark and you're not getting much sunlight. So I think there's obviously so many things we can talk about today. I think that's just like a little taste of all the things I want to talk about. Um, I'm rambling now. Sorry.
No, I think, and actually, I'm so glad you brought that up, the seasonal depression, because a lot of people don't even realize that that's a real thing. Like that's not
It's so
something.
real.
Yes, that's not something that, oh, gosh, I don't like the dark, because I personally do not like it dark. I'm a night person, but I like to squeeze every inch of daylight out of my day that I possibly
Yes.
can. And so it's difficult when it's dark outside, but it does actually affect our brain waves and how we
Oh, it
feel and
does.
our emotions.
Yeah, there's real science to it. And if you ask any physician, what is the treatment, right? If you know somebody with seasonal depression, it's daylight. It's light phototherapy. They even sell these tablets now that you can put right in front of you and it'll just give you light. But if you have the time to get a few, 30 minutes out in the sun during your lunch break or what have you, or spending more time outside on the weekends, getting ahead of it, I think we can do a lot better, or the patients who suffer from seasonal depression can do a lot better moving forward. But what I am, I think, more worried about is as we enter what is going to be, and I think the entire medical community can get behind me when I say this, is what is going to be a very rough cold and flu season now that we have COVID, what is going to be a rough economic landscape for America right now, and the holiday season in general. We have so many things to battle against this holiday season. I would say if you're prone to anxiety or depression, or even if you don't know, you have a question, do I have anxiety? Do I have depression? See your doctor sooner rather than later. And let's have a conversation about how we can get ahead of this before it hits you and before things, seemingly get out of control.
Absolutely. I think those are just very, very important points to be looking at. You had mentioned the importance of community and public health, and especially in the support of the work that you're doing in the clinic, trying to get people healthy. But then, where are they? How are they spending their daily lives? What's their support network? What opportunities do they have in their communities to help them kind of deal with some of the stress, some of the grief. I'm reminded of we lost a very dear community member in August, and she was such an important member because she contributed and volunteered, but because she helped the younger women in the community feel nurtured and cared for, very much like a mother figure. I know a lot of our Latino communities, a lot of our first generation immigrant communities arrive here without any extended family members, any support. They're becoming new moms and having to learn on the go. If they're fortunate, they get caring doctors like yourself that kind of give them the time to guide them with some basic guidance on mothering. But they don't really have what, especially in our Latino community, is very traditional, kind of a cocoon of women that support
Right.
that development of motherhood and the decision making that goes into that. So, when we lose those important, valuable community members, we know what a hole it leaves in these communities, and the importance of then developing, and finding other ways to support the community to go forward. What have you seen now in your practice over the years, as far as your idea of people having established these networks of support for themselves in the community? Are people doing a good job of that? I mean, I know these are strange times with the pandemic, but I mean, what do you see?
Right. I think the pandemic definitely threw people for a loop as far as finding a community that you feel comfortable with and that can help, you rise up when you are down. But I think I'm also seeing younger generations, these millennials, kind of my generation, is having trouble finding community. And I think a part of that is so much of our youth and our adolescence having been through a computer screen or through a cell phone screen. And so when it comes to life really hitting you and you really needing a support system, I find that I have a lot of younger patients that are having trouble. I think in particular, you mentioned new moms. new moms is, I think, the biggest community that I'm seeing in my practice that is having a lot of struggles and a lot of hardship finding a community. The thing I hear a lot is how can I find time for a community when I have to take care of my child? You know, it feels like their entire life is now dedicated to this baby, and they have no time to focus on themselves. So I encourage them, you know, if you are a millennial and you grew up with the internet, use it to your advantage. There's so much you can find on there. Um, Whether it's, you know, the Texas Familias Cancel Facebook group hosting events or sharing events, whether it's a Facebook group of new moms in Conroe, or going back to the basics and going to a public library. You know, it feels so like outdated, if you will, but it's really how we used to meet people, you used to meet like-minded individuals. Um, but that is the population that I'm hearing a lot from as having trouble. They have unfortunately nowhere to turn to. I love the resource guide that you provided me, because it gives me an opportunity to say, you know, our conversation might be over in 15 minutes, but it doesn't mean that you don't have more information to read about when you go home and to peruse through. But I also encourage them, like I said, you use the internet, go back to the public library, find friends who you can watch the baby with and still talk to, because it's a really hard time in a mother's life. And it's is in a way kind of on the topic of grieving. You are grieving the life you knew, and you are welcoming in this new beautiful life, but it doesn't mean that it's hard. You know, it doesn't mean that it's not hard to let go.
Right. Yeah, I mean, and I think that that's, you know, one of the things that, even with these traditions of de los Muertos, that, you know, I personally have reintroduced into my family culture, because we've lost, you know, now 3 grandparents. And so
Yeah.
we're at that stage of life where we're, you know, we're moving through the generations, but it does help us. It helps me, you know, as I'm setting up their picture, and I'm finding mementos that represent, you know, who they were and the things that they enjoyed, and just taking the care to set up a simple altar in the house, has really helped me over the last couple of years. You know, not just remember them and honor them, but deal with my own loss, you know, and my grief.
Yeah.
Sometimes those of us in the caring professions, we're out there all the time, right? 24/7, looking at ways to care for community. But we're also going through things ourselves, and we're also have experienced great loss, and have witnessed a lot of pain and suffering. And
Yeah.
so these traditions also have been a way, to reconnect, like you said, to you know, begin the healing, and you know, be better aware and more mindful
Yes.
of our support system.
I think it's a beautiful tradition, and I think that if if you don't already celebrate it, it's okay to start. You know, there's never been a better time, right? 2 years into the pandemic, you're grieving the loss of whether it's somebody you personally know, or grieving, unfortunately, the millions of people who passed away so suddenly, right? When the pandemic was at its peak. But what I love about Dia de los Muertos is that it is a constructive way to grieve.
Mhm.
It is a hands-on way to say, let me take my suffering and my pain and turn it into something beautiful. And then I get to share that beautiful thing with everyone else. And it's this idea of celebrating life, you know? Um, and while there is pain and grief that the entire community feels, you're still getting together to remember this person, to celebrate the life they had. And in doing so, you are surrounding yourself with people, which I think is my number one advice I would give to anyone who is suffering from anxiety, depression, or grief, or prolonged grief, is go be with other people. Because even though in the moment you think, I really need to be alone, I can't do this, we can't do anything alone. We can't take on such a hard battle alone. And so the fact that it gets everyone together, it gets you to do something constructive with your grief, and you're creating this beautiful altar. And then on top of that, I think that every year it's an opportunity to teach young Mexican Americans about their history. I know that there are some parts in Texas or some parts in the United States or some communities in which we don't celebrate Dia de los Muertos, but it's never too late to start, you know. And I think we have such welcoming communities who would take us in and help us put together our first altar.
Absolutely, absolutely. And we just did one where we put together some altars at the local community college this past week, and inviting
I
students.
saw they look so pretty.
Yeah, inviting students to bring their pictures and share this week, with the community. And so yes, I mean, I think that these are very valuable things. As far as the pandemic, we've kind of had that big wave of the BA.5. Now we're hitting the flu, have hit the flu season.
Yes.
Do you feel people are getting those vaccinations that they need? Would you like to see more people getting those vaccinations? What are you seeing?
I would always love to see more people getting their vaccinations. I think that my elderly population is doing wonderful. I have patients who come in for, let's say, knee pain, for example, and on the way out, they're like, "Hey, I think I want to get my flu vaccine," and I'm like, "Yes, this is wonderful. Thank you for being so on top of it." Um, it's my younger generations that are I think kind of falling off, and I think that confusion around the COVID vaccine is leading to it. Um, I've seen several children in the clinic with flu A, sometimes flu A plus COVID or COVID on its own. We're seeing a lot of other viruses too. The common cold, there is no test for that one, but we are seeing really, really high fevers with those. And I think a lot of people want an answer, right? You go into the doctor and you're like, is it COVID? Is it flu? Sometimes the answer is you picked up another virus, right? But what I am seeing in that population of my younger generation is parents not being aware that you can get the COVID vaccine as young as 6 months old. And your first flu shot should be at 6 months old. So I'll have parents say to me, well, no, they're unvaccinated because they can't get it, and I have to remind them, no, they really can. But at the time that I'm telling them that, it's too late, right? You've already got COVID. Now you can prepare yourself for the next season, or prepare yourself for what might happen in Christmas. Things could change. I mean, COVID is surprising us all the time. But that's what I'm seeing a lot of now. I wish people would get more vaccines, and be more vigilant about it. But I think we as healthcare providers also need to do a better job about rising up and meeting our patients where they are. I think something that I've been trying to do, and that the entire Lone Star Clinic is trying to do, is when you get the patients in clinic, ask them right then and there. Don't wait for that annual exam. Don't wait for that well child visit. You're here right now. Let's talk about this. And being open and having open and honest communication with our patients, really reminding them that they have full autonomy and we are a resource for them. So if you have questions, now's your time. I'm here in front of you. Let's talk about the COVID vaccine. Let's talk about what you heard in the news and whether or not there's merit to it, or if it's something you need to be worried about. Like we were talking about earlier, there's just so much confusion as to like, do I need a booster? Who needs a booster? And I think some physicians will fall into different camps, but I'm of the camp of, if it's been greater than 6 months and you have a chronic illness, and I'm talking hypertension, diabetes, high cholesterol, obesity, very common. I think it's like the top 4 that I see. If you have any of those, it's time to get your COVID vaccine. And I would say now more than ever, right? Because you're about to travel. You're going to travel for Thanksgiving. You're going to travel for Christmas. You're going to go to a New Year's Eve party, right? And even if I don't stop you from catching COVID, or I don't stop you from catching the flu, your course will not be as severe and you won't need to end up in the hospital.
Absolutely.
And that's the goal, right?
Yes.
And I think for those of us who have experience, I think you had COVID not too long ago, right?
Yes.
And we know people who, perfect, right? And so I think we all kind of know that if you had the vaccine before you got the illness, it likely was not as bad as you were thinking. It might be, right? And you likely did not need to end up in the hospital. I remember my husband, when I met him, had not gotten a flu shot in years. And of course, he marries a doctor, so I'm like, you're going to get your flu shot every October now. It's just a part of your life. But he got sick shortly thereafter with the flu, and he always tells me, he's like, I love the flu shot. He's like, that is the first time I got the flu, and I did not feel awful and sick to my stomach. And I remind people, it's not a miracle. We're not going to stop you from catching it, but we're going to make your symptoms a lot better.
Absolutely. And I think I think we've learned that in serving our communities over the past 3 years through this horrible pandemic, and listening to their stories and their fears and their practices. We were talking about, the validation of honoring people's traditional practices of health and
Right.
certainly the value and importance of nature in our health, and returning to some of that, because I think what we have seen even before the pandemic, and the reason why so many of our populations were so vulnerable during the pandemic, was because of these out of control cases of diabetes and high blood pressure and obesity. And people are so under so much stress, working multiple jobs, or caring for children,
Right.
dealing with just everything in life, but we become detached from our daily self-care and our connection to our health and to nature, and why that's something that actually it works and was created to boost us, right? Our immune system,
Right.
and our mental health. And so I think the pandemic has certainly revealed opportunities for us to kind of make those connections again, explore them in a modern sense, and kind of understand how they can work together, both the new medicines, the vaccines, the practices that you as physicians are trying to introduce to us, and then also the traditions of our ancestors. There is that crossroads, right?
Yeah. Oh, and I say blend them. I say do both. I have patients all the time who are like, I feel better after drinking té de manzanilla. That is my cure. I'm going to go visit my curandera. And I'm like, do that, please. That is wonderful. If it brings you joy, and if I'm seeing that you're physically feeling better, I'm all about it. Because at the end of the day, I'm not treating numbers. I'm treating the patient, right? And if it brings you joy, that's your mental health, and that's valuable to me as a physician. I only ask that you continue taking your high blood pressure meds while you do that, blend those worlds. And I think that as physicians, we can do better about asking patients, opening up that conversation. What are your home remedies? What did mom teach you? What did grandma teach you? What are you incorporating at home for your health? And then what can I add to that? Right. And I think that can go a long way to help somebody's health. But you're absolutely right. Unfortunately, we as the Hispanic and Latino community, we're predisposed to getting worse cases of COVID. And that's because viruses will feed off the sugar. They'll feed off the fats, unfortunately. And obesity, diabetes, hypertension, high cholesterol is literally in our genes. And I remind all my patients, whether you're a kiddo, whether you're a teenager or a full-grown adult, I'm reminding you to be health conscious, because you are literally in an uphill battle every day. And if you get complacent, it will destroy you, unfortunately. And I don't want that. You don't want that. Your family doesn't want that. And I think it just takes being a little health conscious, right? And I think the big question is, how can we foster a culture of being health conscious when somebody hasn't been health conscious their whole life, right? How do we make that change? And it's a conversation I have with a lot of my parents and families in their pediatric visits, is we as whether it's the parents or the big sister or anything, if you're a leader in your community or a leader in your nuclear family, I think you have a responsibility to teach the younger generation about health, right? And I always start by saying, you need to talk about health, be open about it, right? Because if you're not talking about health in your family, your children are going to learn, and the younger generation is going to learn that health isn't important, because it obviously wasn't talked about, right? It's not a priority. And I implore them to talk about your doctor's visits. right? Like how did it go? If you went to the doctor, what did the doctor say? And then talk to your kids about why they're going to the doctor if they feel perfectly fine. You know, why does he need to get vaccines? What diseases are we preventing? Being open about those communications, and then getting them involved. I always want my parents to, whether you're a parent to a kiddo or a teenager, get them in the kitchen with you, take them to the grocery store, get the cell phone out of their hands so they can pay attention with you for a little bit. But you know, we as adults are, if you're the grocery shopper, you're making decisions. You know, why did you choose the bell pepper versus the potato? You know, talk about that. So why did you choose turkey instead of red meat? What was your decision making there? And then getting them in the kitchen can open them up to exploring new foods. I get the complaint about picky eaters all the times in my pediatric visits. And it's very common, and I understand that, but I think that we need to recognize that a lot of the processed foods that are advertised towards children are full of sugar, and it is actually addictive. You
Yes.
know, and if you've done nothing but feed them sugar, you know, all the time, don't be surprised when they don't like broccoli, right? So I think coming off of that processed food, coming off of the sugar, and then at the same time getting them in the kitchen, even if it's messy, it's okay. You know, you didn't have kids to have a clean house, right? Like
Right.
it's going to happen. So that's what at least I tell myself that. And I think that getting them in the kitchen and getting their hands dirty will make them feel like, hey, I made that. I want to try it. And I want my whole family to try it. And what do you think about this new thing that I made? I think those are steps that we can take, and it starts individually, to creating a culture that is health conscious. And I think really thinking and talking about why you're fueling your body with this nutrition. What does this meal have to offer you? And I was raised Catholic in the Catholic Church, and we used to pray over every meal before we ate it that it would nourish our bodies. And I think now as a physician, I'm seeing that, you know, we need to go a step beyond that than just saying that. You need to choose the meals that are actually nourishing, right? And I think that it's hard for sure. It's hard to break bad habits, and it's hard when everything on TV and everything on the billboards is being advertised to you to entice you to eat sugary meals, and they're cheaper than the organic food. It's hard, but I think that if you open up that conversation about why it's important, you're not only helping yourself, but you're helping your family. You know?
Absolutely. And I think that, I think one of the revelations of the pandemic, if people really stop to think about it, is, we went through so many conflicts and confrontations about, how to handle it. Wear a mask, don't wear a mask, get vaccinated, don't get vaccinated. But for me, really, what it really posed, the question it posed primarily as a mom, as a mother, wife, and daughter, was, was that mind shift of, wait a minute, we haven't been healthy. We've not been healthy
Right.
for
Oh my
for
gosh.
generations. And so, like, these very traditional things that we're talking about, that, the use of natural remedies in the home, these are ancient thousands and thousands of year old traditions that were learned through the wisdom of people, right? Of watching how connected we are to our health. And so our modern society is very work centered. And so it's
Yes.
work, 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 work. And so we're validated by how much work we do. We're validated and valued by, how hardworking we are. Never mind that we're killing ourselves in the process by
Right.
not prioritizing our health on a daily basis. And yes, the quicker, cheaper alternatives that may take less time are actually harming us, as opposed to, making life better for us. And so if we really stop to think about what this pandemic might have taught us, it really is to everything that you're talking about is returning to the basics,
Oh
returning
yeah.
to those most basic connections with our bodies, what we consume. Because we don't have protests in the street about, don't buy red peppers at the grocery store. I mean, you don't see the controversies about no broccoli. I mean, we're not having
Yeah.
that sort of conversation because we've, I think, been lulled into this comfort zone of just accepting the most minimal or even a harmful alternative to what really we need, which is healthy nourishment, a home health. A healthcare home where we can have
Yes.
conversations with our physicians about what we're seeing changing in our bodies or how we're responding to a pandemic or something else in our life. And all these things working together and the sense of community, so that we can connect with one another, share with one another, and support each other in making decisions that are good for our aging parents. A lot of us are taking care of our elderly parents, and of our children, and so we don't all have the answers. We need community sometimes to help us with that or give us some options or alternatives.
100%.
Yeah.
Yeah, it's very hard, and I think about my patients who want to get better and they come in and they're like, I'm very motivated. What can I do? And one of the first things I ask them to do is to find themselves a group that they can talk to, whether it's your family or friends or it's completely different community. Find someone that you can talk to because anything you're going to start, any new habit you're going to start, it's going to be hard. It's going to be a challenge. Whether your new habit is that you want to exercise 30 minutes a day,
Mhm.
there are going to be days where you don't want to, right? Whether it's going to be eating healthier, you're going to need help with that too. I think just being able to, in a way, commiserate. I hate using that word in this sense because to be healthier shouldn't be miserable. But in a society in which trying to be healthy is almost going against the grain, it can be very hard, and that can
Absolutely.
cause a lot of sadness. I don't know. I think it boggles my mind that our advertisements and our everything is just going against us in so many ways. The cost of organic food versus the
Yeah.
value meal at McDonald's that
Yeah.
can feed a family of five. It's really hard. My my I would say realistic advice to people um, is perimeter shopping, and I don't know if you've heard of perimeter shopping, but it really can get cheaper. It can be cheaper, but every grocery store is mapped out in a way that the produce, the meat, the dairy are all on the perimeter.
Hmm.
And in the middle, you have pantry and canned
Ah,
items.
yes,
And
yes.
so right, and every grocery, whether you're doing Kroger,
Mhm.
HEB, every grocery store is like that. And so what I ask people to do is don't go in the middle. You're just shopping the perimeter. If
Mm,
you want veggies, skip the frozen ones because the bell peppers, the broccoli, everything that's produce is going to be cheaper
mhm.
in the long run. And now it goes bad faster. That's the negative. But if you're cooking just for the week, you should be okay. The meat's going to be cheaper, the dairy, the eggs, everything. And that's all you need for a full, well balanced diet. If you go down the aisles of the pantry, you're going to get sucked in, is what I
Yeah,
like to say.
yeah,
You know, the sugary cereal has a brighter box, you know, the pasta sauce is like organized so perfectly and it's like a
right.
bright red color.
Yeah.
I don't know. I think that you just get sucked in by the advertisement and it's not something you need. I also think gardening is a great way to
Mhm.
understand a little bit more about the fuel you're putting in your body. And I know it's not possible for everyone to start a garden at home. Um, but if you can even get like a little plant in a cup, and nourish that plant, then you can have some idea of I have to give this plant the fuel that it needs to grow. What is my fuel? Is my fuel sugar and Coca-Cola? Or does it need to be protein and veggies and stuff? And I like to recommend the real food diet, which is just if it came from the ground or if it's off an animal, you know, feel free to eat it. But if it's processed, you really, I don't think it's necessary. It's not really fuel. Um, Now, it doesn't mean you can't enjoy yourself. I
Right.
also recommend that people, you know, pick one day is what I like to say. Pick one day where you're going to go out and you're not going to pay attention to the calories or whatever it is your goal is. Um, and you're just going to enjoy yourself. But that doesn't mean that you get ice cream Monday, Tuesday, Wednesday. You know, it just means you pick your one day to enjoy yourself. I think those are realistic expectations and it can lead to a sustainable diet, but nothing is going to sustain if you're doing it on your own. You know,
Absolutely.
you can go to a you can go to a very, I think, dark place quickly
Mhm.
if
Yeah.
you're gonna try to do that on your own. So having that community is huge.
Yes, and I think, and I'm sure you would agree, this is actually a perfect time to take what you're saying and apply it, because as we've moved through some of the darkest times of the pandemic, and I'm hoping the next year is, you know, much better for us all. But it is a time to reflect on our family health and our decision making and our culture as far as
Yes.
how we're prioritizing health. I think that it's easy to get into, you know, an absurd discussion about the politics of public health, but really public health
Mhm.
to me is what our ancient ancestors always prioritized, right? Is that you had the
Right.
elders teaching the young, you know, what was right, wrong, including how to care for our bodies and our connection to
Yes.
our natural settings. That is the most basic fundamental part of humanity as far as, you know, the physical needs and the emotional needs. So I think this is a great time to take inventory of our practices at home, and
Of
have those
course.
discussions with our children, and then find extensions of that in the community. And like you said, even if it means, if something doesn't exist, why can't I create it, right? Why can't I create a
Yeah.
mom's group that, you know, gets together once a week to share recipes or to, you know, and on that line, I wanted to thank you and Dr. Ferry for the wonderful work you've been doing in outreaching to our Latino communities in Montgomery County, with your monthly visits, and that has really made a difference. It has really built trust and connection and community.
Good.
And I'm just very, very thankful because I hear the wonderful, you know, impact it's having. And you can see it. You can see when I have these conversations with members in the community that, you know, there was a time 10 years ago that if I asked that same group of women, you know, who do you talk to about your health, or they would say, well, no one, you know. And now they're all,
Right.
then the answers have generally been, well, you know, the las doctoras, you know, that they come and, you know, they talk to us, and they're sharing these wonderful recipes and these ideas, and it's creating a wonderful support system that I think has a lasting impact on those families and the next generation. So thank y'all for the investment this past year. It's
Of
been
course. I mean, thank you for having us. I think that I can speak for Dr. Ferry and myself when I say this, and then probably every resident that goes out there is it really fulfills a need for us too. You know, there is a reason why we went into practice. There's a reason why we chose medicine. And if you get into the hustle and bustle of clinic and hospital work, you might forget that and you might lose that motivation. I think it is so necessary for like my mental health and my growth as a physician to get out there once a month and have these conversations because it reminds me of why I did it,
yeah.
right? And it's this fuel that keeps me going.
Yeah.
So thank you for having us. I mean,
Oh,
I think
no,
it's
no. I mean,
wonderful.
I just, I think you're right. I mean, people have asked, you know, how did I keep my sanity during the darkest times of the pandemic? And it was that. It was being
Oh
out in
yeah.
the community, serving the community, listening to the community, and then, putting things in perspective of what really matters and what little piece I can personally maybe play in that and encourage others to do.
Right.
So you're right. I mean, it's nourishing for us, and it has an enormous impact in the community. So thank you so much.
Of course.
So in closing, Dr. Cruz, were there other, I mean, we've talked about the importance of vaccination in this flu season, that this is the ideal time right now, like this week, if you can,
Yes.
to get your shot
100%.
and be ready for the holiday season and the winter months when we're more inside and exposed to things, our nourishment and our mindfulness as far as connecting to community. But were there other pieces that you would like to share before we close our conversation tonight?
I think I would, again, just like to piggyback off what you said, it is the perfect time to get your vaccines. If you happen to be a Lone Star patient listening, please just walk in and ask for a nurse visit. We can get you that vaccine that day, and you won't have to wait very long. Now, if you're not, or you don't want to go to Grangerland or Conroe, Willis, wherever you might be, most pharmacies will offer it to you for free if you show your insurance card. And I believe some of them might even do it without the insurance card as well. But it's a really important shot to get. And like I was telling you earlier, even if I can't prevent you from getting the flu or I can't prevent you from getting COVID, I can make those symptoms less severe. On that note, if it's been greater than 6 months since your last COVID shot and you have some sort of chronic illness, please go get your booster. Now is also the time because you're about to go travel and see family for the holiday season. The last thing I just want to recommend as maybe homework, if you will, everybody, I encourage you that if you're cooking holiday dinner, whether it's Thanksgiving, Christmas, or New Year's, please get your kids involved in something. Get them hands-on and in picking maybe have them pick their own side that they want to bring to the table. I think that would be great. And I personally like bringing a side to the family every Christmas and talking to them about what I made. Why did I substitute the granulated sugar for honey, and why did I substitute this for that? So that's just as we approach the holiday season, something to consider.
Absolutely. And Thanksgiving's coming up, and we certainly have a lot to be thankful for. Even though we've all been through the ringer, but we're here, we're,
Exactly.
celebrating life and celebrating all the blessings that we have and learning. We never stop learning. So everything you've shared with us tonight certainly encourages us to basically take that inventory of our life, our decisions, our sharing within familia, within comunidad, and continue to grow that. That's work that I always tell my young volunteers and my mentees. This is not work where you see the end game. There is no real end game. It's a continuity. It's something that's in perpetual motion. It's ever changing. Community is vibrant. It can also fall into decay if it's neglected. And so it requires our investment daily, and the fact that we are, we're each valuable and have an important role to play. So thank you so much. You also mentioned something when we were talking earlier that I think it was worth asking people to be mindful of is if we're going to be together with little ones or babies over the holiday.
Oh, yes.
Be careful, because we can still be carriers of all these different viruses.
100%. So we touched on the flu. I'm seeing a lot of flu and I'm seeing a lot of COVID, but of course we are in the winter, and this is always RSV season, and it has started early this year. And I'm seeing a lot of RSV, which for you and me is going to feel like a common cold, and we're going to get over it. But for young infants, it can really be detrimental. And we are seeing so many cases all across the United States where pediatric hospitals are so full, they're having to open tents up outside just to take care of patients.
Wow.
And they are seeing patients with multiple illnesses. So a double whammy, if you will, of flu and RSV, or COVID and RSV. So I just want to remind everyone, if you have a young child and you're getting ready for the holiday season, consider keeping it to the nuclear family, or being very, very careful with who you invite in. Practicing good hand hygiene. I think there's never a bad moment to practice hand hygiene kids, but also if you encourage grandma and grandpa to teach them, you have both of them washing their hands, right? Or if you teach your kids to wash their hands, maybe you encourage them to get their cousins involved too. And then lastly, no kissing babies. No, we can save the kissing for later, but we as adults might think we have a common cold or we're carrying something and we haven't shown symptoms yet. It doesn't mean we can't pass it on to someone who's more vulnerable. Which I know it's never fun to have to, restrict yourself and say, oh, I can't kiss the baby, but it's what's safest right now. And I think that above all is what's important.
Absolutely. And with the numbers, showing us that, the real danger, I think it's worth it.
It's so dangerous.
Yeah. I think that we should that's the least we can practice for a while, is to make sure babies are protected. So, well, thank you so much, Dr. Cruz. And Dr. Cruz is, again, a physician resident at Lone Star Family Health Center, and practicing family medicine, both in the Conroe location and Grangerland location, which serves our kind of eastern Conroe area. And they're very, very lucky to have you, Dr. Cruz. And I'm very thankful that you've been able to share a couple of conversations with us. And I hope we can continue on these conversations to share more of your wisdom.
Perfect. Just tell me when. It's a blast always.
Great. Well, thank you so much. And I will be making sure that people who watch this interview also have access to the phone numbers for the clinic, and be able to get connected with those important contacts for healthcare. So thank you again so much, and have a wonderful evening.
Thank you. You too.